Time now for a look at your health, and tonight we are talking about the flu season, new strains, and why 10 minutes a day is all you need to protect yourself. Joining me now is Dr. Mitchel Goldman from UCSD, and I am all ears because I've already caught a cold this season, which is frustrating. So flu season starts right now. Are we in for new strains this year? What should we be concerned about?
Well, we always try to predict what flu strains are going to come, and this year we're predicting that it's going to be somewhat of last year's and then a new one. So this vaccine that we're getting this year actually protects us against 3 different types of viruses that we think are going to be very common. Now, the flu season starts right now and runs into the spring, and when you get your vaccine, it takes 2 weeks for it to become effective, and that's why we're doing this segment now. We want everyone to get their flu vaccines now. Pharmacies have the vaccines, your doctors have the vaccines, it's covered under the Affordable Medical Care Act, and so there's no reason not to get the flu vaccine.
And for certain people it's more important than others. We actually have a list of the people who should get the vaccine, starting with nursing home residents, right?
It really is. People over 65 and the elderly that are more susceptible to different types of diseases, or when they get the flu it's going to be more severe. Infants, young kids are going to get it harder, and then interestingly, pregnant mothers. So if you're in those categories, absolutely. Healthcare workers for sure, because we're seeing people all the time. I would say also flight attendants, even if the seats are falling off the planes, you know, there's a lot of people in those planes, and so if you're going to be taking a flight on a plane, make sure it has good seats, but also get your flu vaccine.
And there is that sort of misnomer, I guess you could say, about getting the flu vaccine, that it will cause the flu later on, and I think that's why a lot of pregnant women or people don't want to get their children vaccinated.
Yeah, but there's no reason why you shouldn't. You know, 95% of all physicians get the vaccine. The other 5% of physicians are idiots, but I'm just kidding. But it really means that the physician's doing it, you really should. There's no link at all to getting any type of disease whatsoever by getting the flu vaccine. And Kathleen, even though you're a little bit sick and under the weather now, it's a cold. It's not the flu. The flu is very different. When you have the flu, it's not a cold. You're really sick. You're in bed. So you don't want to get the flu.
I agree, but let's get to the meat of this then, because I told you I really want to find out, for personal reasons as well as for our viewers, what is this 10-minute regimen a day that I can do that's going to help protect me from getting the flu?
It's what we say every Tuesday night. It's exercise. Exercise is such a good thing on so many different levels. Not only is it going to prevent diabetes, decrease strokes, decrease high blood pressure, keep your weight down. It also builds up your immune system.
But how much exercise?
Just 10 minutes a day.
That's it?
For the flu, 10 minutes a day. Other things you have to do a little bit more, but eat right. 10 minutes a day, walking. Park your car a little bit farther away so you can walk more. Try walking up the stairs instead of taking an elevator. There are little things we can do every day to try to get us more exercise.
All right, when you think about it in those small increments of just 10 minutes, then it seems like something we could actually put into our lifestyle.
Absolutely,
so
everyone can do it.
And don't forget, the Affordable Health Care Act does cover the flu shots, as Dr. G said. So, Lauren, there really is no excuse not to get it. So thank you so much.
It's good to be here.
All right, great advice. Thank you.